Okay. Welcome to the League of Women Voters Winter Membership Meeting. Please, and again, we're muting ourselves if you're coming in. My name is Kathy Leonardson, and I'm a member of the Marblehead League Steering Committee. Our moderator this afternoon is Catherine Redmond, LWV Marblehead Steering Committee member, and she's also our membership chair. She'll be introducing our speaker in a moment, Mr. Andrew Petty, Marblehead Public Health Department Director. But first, it is a membership meeting that we're doing, so anyone that might be interested in the meeting in the league gets a little information. The League of Women Voters is nonpartisan with respect to candidates and political parties. It was formed in 1920 as women gained the right to vote, and in fact, it was started by suffragettes. The League is dedicated to the principles of self-government established by the Constitution of the United States. But how does the League work? Basically, we're a grassroots organization, and the grassroots is really the foundation that drives activity at the state and national levels, and of course at the local level. We do studies on issues that arise, form an official position through a consensus, and then based on the positions, we can weigh in on anything from proposed legislation or town meeting articles. For example, we strongly advocated and continue to for police reform at the state level. And we supported the bill that went to the governor, even though he kicked it back. We're interested in citizen engagement, getting people to register to vote, making voting easy, protecting the integrity of the vote. We hold forums on issues or forums for candidates running for office. Those are some of the key things we do. You've probably seen us in Marblehead. We remind people to vote with signs and I voted stickers. And we really loved involving the students with panel discussions or voter drives. This work is headed up in our league by Sherry Pressman, our voter service chair. A few of the other things that we do. The Observer Corps is one of the things that's really come to the fore during the pandemic. League members attend town board and commission meetings, and our notes are posted on our Facebook page and also on our webpage. These are printed in the Reporter from time to time, and that's handled, the whole thing is handled by member Bonnie Grenier. We have a third Friday current events group open to all league members, and we have a legislative envoy program. We have a book club, and we have a gun safety group, although that one hasn't met recently, but it's still on the back burner. We have ongoing interest in affordable housing, the environment and climate change, and education has always been a longstanding interest to us. A year ago, we began celebration of the 100th anniversary of women's suffrage with 3 public programs. But over time, through our book club and thinking and reading, we realized that not all women got the right to vote in 1920. So we moved into forming a racial justice group. On October 12th, this year, we had on Indigenous Peoples Day, we did a program that was recorded on Zoom, Black Women Suffragists. Kathy Mary Michael, Donnie Grenier, Jody Howard, Lee Mondale, Sherry Pressman, Kathy Hempel, and myself took part in that. We each researched a Black suffragist and presented a short part of the program on the different ones. We also included a woman Indigenous person that worked for Indigenous rights. Well, we welcome all to join us. Our membership is open. It costs exactly $60 a year. You receive a newsletter and updates from national, state, and our local league. If you want more information about our league, you can go to lwvmarblehead.org, our website. But I want to read the vision statements of the league, which I personally find inspiring. We envision a democracy where every person has the desire, the right, the knowledge, and the confidence to participate. The league empowers voters, and we defend democracy. Now, I think we're ready for the program with Andrew Petty, and we're really looking forward to hearing from him during this time in the pandemic. So I'm going to turn it over to our moderator, Catherine Redmond. Thanks, Catherine. Catherine, you're muted.
Okay, thanks. A big welcome to Andrew Petty, our Director of Public Health here in Marblehead, who's generously offered his time to be with us today. Andrew's worked in public health for the last 14 years. He began his career in 2006 serving the town of Wellfleet as the Assistant Director of Health and Conservation. And in 2011, he moved his family to Marblehead when he became our Director of Public Health here. Andrew is currently also the chair of the Region 3D Emergency Preparedness Coalition and represents 3D in the local and state advisory council for public health emergency preparedness. Andrew holds a Bachelor of Science degree from UMass Amherst and is a registered sanitarian. We're so happy to have you here. Andrew's going to talk to us in general about the overall range of responsibilities of the Marblehead Public Health Department and the status of COVID-19 in Marblehead now. After Andrew's finished talking, we'll have a question and answer session. So please, as your questions arise, use the Zoom chat function to write them in. If you're unfamiliar with it, there's a chat button at the bottom of your screen, and you can click on the chat button, and then a chat screen will appear on the right-hand side of your computer. And at the very bottom of it, there's text, type message here. So type in your question, hit enter, and you're all set. If you're on an iPad, you'll look to the upper right-hand part of your screen, and you'll see 3 dots. Press on that menu and select chat and follow instructions. And once again, you're all set once you do that. So at the end of Andrew's talk, we'll respond to the questions from that people have written on chat, and then time permitting, we'll allow extra questions for people who have trouble with the chat function or questions that arise through a show of hands. So Andrew, over to you.
Thank you very much. It's a pleasure being here with all of you today. And yes, I'll be speaking about COVID-19. So COVID-19 is a long duration, rapidly evolving event. And yes, it's long duration because we're going to be in this for a long period of time, and we're going to be in this until hopefully everybody's vaccinated, but it is rapidly evolving. Every day we have new case information, we're getting new orders from the governor, and we have to make sure that everybody is aware of this, that restaurants are aware of this. So that's one of our main jobs. But how did this begin? So this event started obviously over in Asia, started in China, and we saw it starting to build over there. We didn't take the warnings very well. We saw the issues that were going on, and we kind of just watched the TV and watched the TV and watched the TV. Finally, after a long period of time, it finally made it to the US. And there's very different ideas of actually when it hit here, but I'll talk about when it hit Massachusetts and when it kind of hit Marblehead. So back in March, we saw that it started to come into Massachusetts. One of our first events was at the Biogen, and they had a Biogen conference. And so when we look at the COVID virus, we're looking at it that it came from actually 2 different areas, coming over from Europe into the eastern coast and coming over from Asia into California and the western coast. So it hits Boston. We start to see some news talk about it. We see it on the news. We see it on the internet. We finally have, on March 10th, the governor finally says we have a major issue. We have this major communicable disease that we know some about, but we're not really sure how we're going to be able to control this. So on March 10th, he declared a state of emergency. On March 13th, we actually had our first case in Marblehead. And this case was associated to the Biogen conference in Boston. And how do I know that? So we use a system called Maven, and this is our communicable disease tracking system or software. We have it. I have a secure login to get into the system. Only myself and the public health nurse has the secure login for that. And it's for tracking communicable diseases. So what's a communicable disease? We're talking hepatitis A, B, C. We're talking measles, salmonella. See, these are the basic diseases that we track on a regular basis. Salmonella, this is a fecal oral transmission. We see this very often in restaurants. This is foodborne illness issues. we're very good about tracking salmonella cases. And if I have enough information, I can actually go back to the exact person who started the case. And there's many historical cases that people are familiar with that we can talk about. Obviously, some of the other ones are sexually transmitted. And then something like COVID-19, this is an aerosol droplet transmission. So we get the information that we have our first contact or first case in Marblehead. So we log into the system, we get the person's information, and it's our job to follow up with that person and start to do contact tracing. So we call the individual and we start to ask a list of questions. Where were you? Who are you interacting with? And we're really trying to figure out when his symptom onset started. So when did he start to develop symptoms? Runny nose, a fever, diarrhea. With COVID, there's so many symptoms. It has masked a lot of things and can be confused with flu. And we can talk about that further. So when did your symptoms start to develop? And then who were you around? What's the definition of a contact? So if I am a positive case, I now have to try to identify my contacts. A contact is an individual that has been within 6 feet, unmasked or masked, it doesn't really matter at this point because we're not wearing an N95, and for a period of 10 to 15 minutes. And you have to remember that this is communicable. So I can be talking to this person for 3 5-minute sessions over 24 hours. So in an office setting, this can occur very rapidly. So person across the hall from me, I had a 5-minute conversation. We were pretty close together. I was hanging out at our desk. We were talking about the sports over the weekend. I go back later, we have another 3 or 5 minute conversation. So if I've been talking to that person for a period of 10 to 15 minutes, I am now considered a contact. And so it's our job, the public health nurse, to call that individual once we receive that information and notify them that they have been notified as a contact and that person is now under quarantine. So the person that is the positive case is under isolation. So we have 2 different terms, isolation and quarantine, and these often get mixed up. So the person under isolation is supposed to be isolated for, about 10 days. And, running through the virus and stuff like that, you go through a different series. So I get the virus. Usually on my 5th day, the virus load is probably the largest in my body at that point. I'm really pushing or shedding virus. It's dropping. I'm breathing it out of my mouth. And this is where a lot of people pick it up. As it continues on, I'm shedding less virus towards the end. Now, the hard thing with COVID is that we do believe that it has mutated several times. In the very beginning, it was much more severe and we saw much more hospitalizations compared to what we're seeing now. Now, there's 2 pieces that's probably going on with that is that the hospital has realized what kind of drugs are appropriate to give that are working the best, and they're able to keep people out of the hospital. We're also seeing a difference where it's hitting not necessarily the higher age groups, but we're also taking less precautions for the lower age groups right now. And so we're seeing it a little bit more there. So 10 days for isolation. Now, to get out of isolation, you need to be symptom-free and fever-free. In the beginning, the temperature that we considered a fever has changed slightly. So another rapidly evolving situation. So that's for the isolation person. As soon as that person is fever-free and symptom-free, they can come out of isolation. Now, in the very beginning, we did have CDC guidelines that maybe people should test out of isolation and that they needed 2 negative tests to get out of isolation. That continued to be a problem for some of us. I actually had people early on that were stuck in isolation for up to a month. I couldn't get the 2 negative tests. And what the reason was is that the virus, the testing procedures and the test capabilities were so strong that they were still able to pick up dead DNA cells from the virus, and they kept triggering the positive case, a positive test result. So we had to really shift down to, are you symptomatic and are you still have a fever? If those 2 are no, you can now come out of isolation. Now, a person in quarantine, we've notified that person that they're in quarantine. At the very beginning, quarantine was 14 days. You could have an incubation period of up to 14 days. So that first day that I have contact with that person, it's going to take a few days for the virus load to excel and really enter my body. And it might take as long as 14 days. Now, we've changed a lot of that. And there's different reasons why we've reduced some of that time. And I can talk about that later. But if you are a contact, you are under quarantine, and you do need to remember that you are not allowed to leave your property unless you have to go to a medical or other doctor reasons. You're not allowed to walk down the street, and you're not allowed to do the same thing if you're an isolated person. I can't have isolated people walking down the street, tripping and falling, and now create another medical event where I have to send an EMS and fire, and now we have a potential other exposure. So those are a lot of things that people have to remember. So we had this case in Biogen, and that was really the kickoff to this long duration, rapidly evolving event. So what happened? We had to close schools, we closed office buildings, we closed restaurants and bars, and then we had to slowly think about how we're going to begin to open some of these things up. And we did this with orders or sector-specific guidance. Well, what's the best way to do that? So at first, yes, I'm the chairman of the 3D, which is all the North Shore communities, Lynn, all the way up to Gloucester. So we speak on a regular basis. The directors get together, and we started to have meetings. And we had meetings with the state Tuesdays and Fridays, and we met with the directors on Wednesdays to talk about, all right, what do we need to do? How can we band together? And what we didn't want to have happen was that, so a Board of Health can enact an order, we can do it pretty quickly. We can actually change and make a regulation in 2 weeks. But how are we going to get ahead of this disease? And how are we going to make it easy for people? If I have one order in Marblehead, and now I'm going over to Salem to do my shopping and stuff like that, do I now have to deal with a different order? How am I going to know about that order? So when we talked about everything originally, we said, all right, this needs to come top down. This needs to come from the governor's office and work its way down to all the communities. So all the communities are following essentially the same orders and laws. So I'm not having to deal with the different patchwork of rules and regulations as I enter into Swampscott or Salem or any of these other places. Now, we've had to make some minor adjustments due to certain issues in certain communities, but that was the general law or rule that we really wanted to follow. The governor makes the orders. It comes out through Department of Public Health. We get these guidance, we review the guidance, we ask questions, and then we begin to pass this around to everybody that's interested in those. So as far as the guidance goes, there's a huge number of sector-specific guidelines that we have. I think actually there's 15 different guidelines for all the different restaurants, outdoor recreation, office buildings. So we have to remember to pay attention to those. And those are also rapidly changing depending on what's going on with the virus. We have limits on gathering, we have travel, we have face masks and facial covering orders, business, education. So with every change, I have to remember to take a look at those guidelines and pass them on. Now, it's not my responsibility to make sure that every sector has this, but I get a lot of questions. So it's self-certification. So if I'm a business owner, I'm supposed to be checking in with the governor's office, and it's mass.gov, COVID, and you can see all the information there and see what I have to do for my sector-specific business or other guidelines. So as long as I'm following that, I should be okay. Now, obviously, we get a lot of questions, and we can start to begin to open things up. So schools are closed, the restaurants are closed, we could only do takeout for a period of time, bars were closed, hair salons, like you name it, everything was closed. We were all home sitting, I was going to work, but everybody's sitting at home, and we were able to really control the disease pretty well. July, I was seeing 10 cases a day, August, 12 cases a day, nothing that we really couldn't handle. So we continued on, we're trying to learn from all these different things. But one of the hardest things that we were hit with in late spring, so end of April, was that unfortunately, yes, we were all home and doing our best, trying not to move around. It got into our long-term care facilities. And the long-term care facilities were devastated. So that's really where one of our major issues was. And we need to try to look at that after the event and see how we can resolve this. One of the issues was that we had employees jumping from facility to facility, not taking off their clothes when they left one facility and changing into new clothes in the new facility. So that's something that we really need to work with. And that was really at the end of April. And what we did was that we were seeing clusters that were forming in these long-term care facilities, and we were able to access the National Guard and the state government to come in and do rapid testing to try to figure out how many people in the long-term care facilities were positive and how could we deal with that? Do we need to move people around? Do we need to freeze people where they were so they were not bringing the virus to other places? Some long-term care facilities closed their doors and essentially said, we're going to keep who we have here and we're not going to let anybody in or out. Other facilities had no choice and they were required to allow new people in and new people out. So that caused some other issues. You might be COVID-free for a period of time. A new patient comes in, that patient's COVID positive, and now the disease can move around a little bit more. So that is one area that after this whole event is over, we will be looking at long-term care facilities and possibly creating some laws or guidelines that they need to follow so we don't have this disease transmission occurring from facility to facility. And one of the hardest things about my job is that I do have to take a look at the death certificates for COVID and other morbidity issues. And so I have to decide when I look through the death records, is this a COVID comorbidity or is this just a death by heart attack? So on your death certificate, if you read the whole thing out, it has potentially comorbidities. And so our guidelines were that if it fell in the first or the second comorbidity, we would consider you a death attributed to COVID. So when we take a look at that death count, and I'm sorry to say it that way, that's how we're taking a look at it. So yes, currently we've had 31 people die in Marblehead due to COVID, and we'll continue to look at that to make sure that we haven't missed anybody. Sometimes these cases take a while to review, take a long time to all the information to get into the system, but we will continue to get those. I do get the death records on a monthly basis, and I review all that information. Not everything, that were some of the hardest days. We're looking through all these pages and pages of people that have passed away and having to say, all right, Janet Smith, unfortunately you passed away to COVID and we need to, add you to the numbers. So as we move past that, the summer really wasn't too bad. Everybody's outside, schools were closed. People were doing a really good job of keeping their distance, doing what they're supposed to do for the most part. And like I said, we weren't seeing that many cases. We were seeing, July, a total of 10 cases. So I get like a case every couple of days. August, 12 cases. September, 11 cases. October, 15. So what's going on here is that as the weather is changing, our habits are changing. We're also getting what we call COVID fatigue. We're tired of this. I don't want to do this anymore. I really miss my friends. I really miss my family. I just want a normal life. Can't I just go out and do this stuff? We started to see poor behavior and we started to see transmission increase. Obviously, one of the kickoff points really for the next second wave. So we had this first wave from March through April into June, then it started to die off a little bit, low threshold for cases. And then in October, we started to see this build. And this build really started to occur around Halloween. Halloween, we had to make some tough decisions. Were we gonna cancel Halloween? Were we gonna allow it to move forward? And we had a lot of discussion about this. And kids are having a hard time. Mental health started to really become an issue. And we wanted to say, if I canceled Halloween, what was going to happen? What was the outcome or what was going to be some of the risk? The biggest risk if I canceled Halloween was that now everybody's going to have private parties. And it might not be inside, but it might be outside. And we're going to have these gatherings. And gatherings are going to encourage transmission. It's going to encourage poor behavior. And especially if there's alcohol involved, there can be more poor decisions being made. And people are going to relax and not be as vigilant. And we started to see the case count climb. So October, 15 cases. November, as soon as October is over, we started to see cases 5 to 7 days after Halloween. And we started to see this increase in this wave that we're in now. And unfortunately, what's happened is that we have relaxed a lot of our regulations. Kids are back in school, but we're allowed to go to the restaurant and eat, for a while for up to 10 people. It started at 6. We could go there unmasked. We're allowed to do a whole bunch of different things that we weren't allowed to do beforehand. And like I said, we have to now remember that we're seeing a lot of COVID fatigue. and people started to be not as vigilant as they were. They're gathering together, and this is starting to climb. The other big change that's happening here at this time is temperature change. And the temperature change is a big one. It's because now we're starting to drive people indoors. And indoors, this virus loves and can thrive and stay there and move around very easily. And so the two places that we begin to see what we call clusters or a lot of transmission is in homes or in workplace settings. And so this is like, and we call these informal gatherings. Anytime, we saw them at athletic events. So my kid's playing soccer, my son's playing soccer on the soccer field. Hey, there's Joey, my buddy. I'm going to go and talk to him. Hey, yeah, we're outside. We're 6 feet apart. I don't need to have a mask on. I'm good. But we start to talk. We're friendly. Oh, he's fine. And we start to get closer. So that's an informal gathering, and we possibly just had a transmission occur. And so this is what starts to build. So we have sports going on, and we saw a lot of transmission in hockey. And it wasn't necessarily the kids. We saw it more in the parents gathering in the bleachers and stuff like that. So this is all contributing to the rise in cases as we go forward and forward. So that's kind of leading us to, where we are today. And we're having to change, and we've had to change a mask order. So no longer are we allowed to be outside, maintain our social distance from everybody. And really, that's the biggest piece that people need to remember. Social distance, stay 6 feet away from each other, mask on at all times, and just remember, wash your hands, preventative things. And if I have any symptoms, we need to start to stay home. So for a long time, we had orders that said we could go be outside as long as we're social distant. We were fine. We started to see this increase in cases, and we knew we had to try to project a difference. We need people to really start to be vigilant and take this seriously. We understand that people are very tired of this, and that COVID fatigue is really kicking in. And you have to remember that COVID fatigue is really kicking in for hospital employees. They've been working day and night. And so they're really tired of this too. And it's hard for them to see this increase. And so now what's happened is that we're being flooded with cases. And this is a little bit out of control, and we're trying to gain control of it again. So the governor created Order 56. We've had 56 orders from March 10th all the way up to now of the governor coming up with different sector-specific changes, gathering limits, social distancing changes. And now we hit Order 58 on December 8th, which becomes effective on December 13th, which we go back. We're now moving backwards. We're going to phase 3, step 1. So we're going back to changing outdoor gatherings. We're changing indoor gatherings because the virus is really exploding at this point. And so how did that happen? Obviously, yes, it started right after October with the Halloween, and then it began slowly building and building. And our real kickoff point was Thanksgiving. And Thanksgiving is a huge tradition for so many people. They get together with their family. We need to continue with these traditions. My mental health issues aren't so good. I'll just see my family for a period of time. Well, unfortunately, with these events, it's just increasing the number of cases. 5 days, like December 1st, my computer just started going nuts. I started getting emails after email after email of just case report, case report, case report. And I was seeing 10 to 12 cases a day. And that has continued since December 1st. So what are the things that we can do to try to combat this at this point? Obviously, one of our other concerns is flu. We're entering into the flu season, and flu has the same symptoms as COVID. So this fall, we wanted to make sure that people were aware of this, and we wanted to make sure that we're trying to get everybody vaccinated for the flu to be able to rule out the flu and say, all right, maybe my symptoms are contributed to COVID and not just the flu. We took a very large step this fall, and in schools, it's now required that every student has the flu vaccine. That's a huge step to where we were last year. So now, starting by December 31st, every student in public schools has to have a flu vaccine. And yes, we will be making sure with that, and we'll be making sure everybody has certificates. And that we're trying to reduce the amount of transmission as far as flu goes, and try to just concentrate on COVID. We've always tried to emphasize the importance of flu vaccine for the elders. And obviously they have a new senior dose or a super dose for anybody 65 or over. We offer flu clinics, and we did a flu clinic this fall doing a drive-through clinic. That drive-through clinic was actually a test for us to see if we're able to run. So we do emergency preparedness all the time. We have emergency preparedness coalitions on the North Shore. I sit on the local and state advisory council for emergency preparedness. And we want to make sure that when we're getting into these pandemics, that are we going to be prepared? We're never as prepared as we want to be, but where are we? So flu. So we do this drive-through clinic. We're able to vaccinate 150 people outdoors while in your car. And we're able to do that very successfully in a relatively short period of time. We ran for 4 hours. We did 150 people. It was about 110 cars. And so we use that as a model. And we use that as a model to, can we do this on a large scale? We use our high school as our emergency dispensing site location. And we can use these emergency dispensing site locations for several different things. Yes, for flu vaccine. If we had to deal with the nuclear fallout and we needed potassium, potassium iodide and stuff like that, we can do that through these drive-through clinics. We can break up the community into 5 different regions using our trash collection and say, on Monday, region 1's going to come. On Tuesday, region 3's going to come. And we can start to vaccinate people in that fashion. Now, we won't be doing that for the COVID. COVID's going to be coming down slightly different. But if we get to the general population and we still need to do vaccinations, most likely we will be doing a drive-through clinic for COVID. So where are we now and what do we need to do? So yeah, I talked about the mandatory flu shot for the students. And yes, there's a lot of talk about the vaccine coming, and that's great. And I'm really looking forward to the vaccine coming. We're going to save a lot of people. My concern right now is that people are now getting focused on the vaccine while we're in another, which could be a huge wave. So this wave could be bigger than the first wave, and this wave will be bigger than the first wave based on our numbers. So we had Thanksgiving, and now we're moving into the holidays. And so we always thought that 7 to 10 days after an event, so Thanksgiving being the event, would be like my peak. Dr. Fauci reminded us that the peaks tend to be 2 to 3 weeks after these events. And so with everybody out, and when I have my public health nurse now contact these 10 to 12 people a day, and yes, the state has created what's called the CTC, which is another contact tracing collaborative, which we can dip into. My contacts are so much greater. So people don't just have 1 or 2 contacts of family members. They now have 5. They now have 10. We're now quarantined whole teams. So our workload is jumping not just exponentially. It's not 100% over, it's thousands of percent over. My public health nurse was just calling 2 people before. Now we have to call, all these different people every day. We're on the phone nonstop. We all have extra lines. We use cell phones and just to make sure that we're available at all time and try to get hold of these people and try to reduce the numbers. So that's one of the things that we're dealing with. But as we enter and we start to talk about this vaccination, we're very worried that people are going to be concentrating on that vaccine. Oh, that vaccine's in Massachusetts. We don't have to worry so much. It's really important that people continue to be vigilant, and you're going to have to make some very large sacrifices. You're going to have to stay away from your family. We're recommending that, during the holidays, again, just like Thanksgiving, you only have holidays with the people under your household. I know it's really hard. Yes, a lot of us have access to Zoom at this point. And yes, it's great to see everybody's faces and stuff like that. Obviously, a lot of us, I haven't hugged other family members for a long period of time, and those things are very hard. But we still have to maintain the course. So we have to make these sacrifices because it can get so much worse. And so much worse means that we're back to closing our schools. We're back to closing our restaurants. We're back to closing all these things that we look forward to. We're back to closing fitness centers. So we're kind of pushing ourselves back into these little boxes. And unfortunately, that just increases the mental health issues. Mental health has been a very large challenge during COVID. We all feel isolated. Yes, we have Zoom and we can talk to each other, but that has been a huge struggle for all of us. And so, yes, the state has set up 211 phone calls so you can call in and try to receive help. But that has been a driving force when we've been making decisions about schools. Schools have been very challenging to deal with. When we started back in September or August, we got a certain guidelines from the state to say, all right, these are the metrics that you're going to use for schools. And as long as you can hit those metrics, you're allowed to stay in school. Cases started to go up. The state said, all right, we've reviewed this and we feel like we're going to change the metrics a little bit. So the metrics were actually changed 4 times on us all this fall. So when we hear people say, we want our kids back in school, we want our kids back in school, it's very challenging for us to try to deal with that because we had a metric that the government gave us back in September, August, really, that we made agreements with teachers and everybody else, employees and stuff like that to say, all right, these are the metrics. If we hit this, we'll shut everything down or we'll be a red community. Like I said, they've changed those metrics currently with the metrics that they are now. So we used to be a gray, green, yellow, red system. It's still the same colors, but it's harder to hit those different numbers. We're currently a yellow community. I don't believe we'll ever be a red community. I don't believe we'll ever have a percent positive rate over 5%. That's a very high number, especially with the amount of testing that we're able to do today. One of the things that we didn't have as much during the beginning was testing infrastructure. And the governor always said this is something that he really wanted to build on. And we probably do the most number of tests in the whole country per day, but it's still not enough. And obviously, when we talk about environmental science and stuff like that, the solution to pollution is dilution. So if I'm diluting my numbers, I'm always keeping that percent positive lower. And I know that can get confusing for people, but that is one of the things that's occurring right now. I'm able to test so many people. We tested there's 2,800 people that were tested in Marblehead in the last 14 days. So that's a pretty large number. Only 108 of them were positive. So that's the dilution of it. Yes, it's great that we're able to test that many. It's great for surveillance reasons. We want to know where the virus is. We want to be able to deal with it, but it's always going to keep that number low. And therefore, we're always going to stay a yellow community. I don't want people to say, oh, we're yellow, we're fine, we still should be cautious. We really need to understand that we've changed the metrics. And if this was back in August, we would be a screaming red number right now. So it's hard for people to understand that. If you're not following along exactly, you might be lost in that a little bit. So how is the vaccine going to come out? So initially, the vaccine is going to go to healthcare workers, long-term care facilities. We recognize that we had a tremendous issue there, and we want to make sure that they're one of the first people vaccinated. Police, fire, EMS, and other frontline workers like that. That's going to be phase 1. So that is pretty easy to administer. It will be sent to hospitals. It will be sent to some of these other places. So we are signed up. I did fill out the paperwork and submitted the paperwork for the vaccine recently. So yes, we will be at some point a vaccination office, or we are capable to do that. One of the concerns and one of the issues that we've been dealing with is long-term storage and the temperature that this vaccine has to be stored at. Depending on the company, it has to be stored at anything between 0 and negative 74 degrees Fahrenheit. That negative 74 degrees Fahrenheit is very challenging for us. There are some things that we can do. We're talking liquid nitrogen levels at that point. So what's the easiest thing to do? Dry ice. So we know I can use dry ice for storage. I can use a basic styrofoam cooler. And by using dry ice, I can actually store vaccine for up to 30 days. We have begun to see some of that. Now, obviously, I can't give you a shot at negative 78. So there will be a transition in temperature rise for the vaccine before it gets into your body. But that is a challenge for storage. But it all depends on the company and the virus or the vaccine that they're using. So that is something that we're working on. And we have in the paperwork, we identify to say, yes, I'm capable of storage. I'm not capable of that deep, 74 degree Fahrenheit storage. And that they'll make, they either will issue us a freezer or they'll issue us guidelines on how to do that. So phase 2, Phase 2 vaccination, we'll be looking at comorbidities. So do you have a heart condition? Do you have cancer? So that puts you higher up on the list. Early education, we want to make sure teachers are vaccinated. They're potentially being exposed by students on a daily basis. That's anyone from K through 12 teachers. Grocery stores. So grocery store employees have been hit really hard. And at times people were calling them frontline workers. That's true. We saw some transmission occur in grocery stores, and you saw a lot of different guidelines in grocery stores. We made aisles one way. We limited the number of people in there. We made sure that the grocery store carts were washed off. We had to take steps to try to reduce the transmission that was occurring in the grocery stores. So they have been a concern for us, and we want to make sure that they're higher up on the list. Utility workers, and adults over 65. That adults, again, over 65 is a concern age, and we want to make sure that they're higher up on the list. And then phase 3 is what we call general public. There's a couple things that we haven't worked out yet for the general public is that we don't have trials for children yet, and we haven't completed trials for pregnant women. So those are two different groups that we still need some information before we can really begin mass vaccination on them. So obviously I can go on and speak about many different facets of this, but I'm sure that you guys have a lot of questions, and I wanted to leave some time for you guys to be able to ask and answer any of those questions.
Great, Andrew. Thank you so much that you gave us so much information and also generated in all of our minds probably a lot of neat questions. I'm going to just go through what we have here. And our first question from Jean, you partially answered, but I'm going to read it anyway because there's not completely. Andrew, where will we find our priority for the vaccination, and where will we go to get it? I know you addressed the priorities, but how are people notified, or how do they, if they consider themselves a priority person, how do they request the vaccine?
Yeah, so if you go to mass.gov under COVID, they have a new section under vaccination, and they actually show the phased approach of who is going to be vaccinated. And I'm going to say when, but it does not give a timeline to that. So you can be able to understand where you are in the list. After that, you're going to have a conversation with your primary care physician, and you and them are going to discuss your health concerns or where you are with your health. And you're going to decide, all right, yeah, I do have a comorbidity. And so I am going to be phase 2. Doctors' offices are also listed as vaccinators in our system. Our system says there's 3,000 vaccinators in the state of Massachusetts. So when we say 3,000 vaccinators, the health department is considered a vaccinator, and that's one. CVS is also listed as a vaccinator, but they have multiple stores across the state. When we looked at trying to do mass vaccination across the state, we understood that if we were just going to rely on our doctors and our public health offices, that we would not be able to vaccinate everybody in the time allotted. So we needed to begin to look outside the box, and the perfect people that started to fall into that was pharmacies and EMS. So we have written orders to allow pharmacies to now do a lot of vaccinations. A lot of people go now to your pharmacy to get your flu shot. The EMS side is another piece that we needed to tap into. We have our EMS and our ambulance systems doing COVID tests, and they will also be part of the vaccination program.
Andrew, what was that site you mentioned at the beginning about where you can eventually find out about your
mass.gov, mass.gov. Yep.
Okay,
I'm on mass.gov site all day long.
Okay, wonderful, wonderful. Why and how does the virus mutate? Is another question.
Viruses mutate regularly. So a lot of times viruses mutate because they might recognize that they're killing everybody else off, and they need to change a little bit. Viruses change over periods of time all the time, very similar to the flu. The flu is a mutating virus, as we all know. So H1N1, they all have different names because they're different variations to it. And when we're designing the flu shot, which is changing over time, what we do is that we look down to Australia and we try to figure out the 4 most common flus of that season and put them into a vaccination. So your flu shot, and that would be a quadrivalent flu shot that you're getting. So we're vaccinating you for flu, for the 4 most highest flus that we saw in the last year. And the COVID's kind of doing the same thing. So it changes, and we're seeing it. So currently it's not as, it seems like it's not as deadly. People are getting it. They're not getting as sick. We're also still seeing a huge number of people that are asymptomatic COVID carriers. So asymptomatic means that you're not showing any symptoms, but if you're tested, you're tested positive.
Andrew, what is the current caseload in Marblehead and the current death total?
So our total cumulative cases so when I ran the report on Thursday, and I ran the report this morning, but I'll talk about that at the end. We've had a total of 503 confirmed cases. Now you have to remember that's not going to capture everybody, and it's not going to capture a lot of people in the springtime when we didn't have as much testing that we wanted to. And at times we were telling people to just stay home and not get tested.
Mm-hmm.
We have a total, so 103. I've had 62 new cases since the week before. And I have a total of 53 active cases. Active cases are people currently under isolation.
Mm-hmm. What about the current death total for Marblehead?
The current death total is 31.
Okay, thank you.
And I have to do another review of that. I just got the report from the town clerk, and I'll be reviewing that. And if I have to add any new cases, I will be doing that.
Okay, thanks. Another question, will testing continue out at the temple?
Yes, so we have 3 additional days with testing out the temple. So Tuesday, Friday, and then the Monday. Unfortunately, it was very popular. It's full at this time, and there's a possibility that we can add some additional days, but there's so much testing going on across the state that everyone's very busy. Lab capacity is kind of maxed out, so we're not so sure that we'll be able to add additional days. The next best place to get tested is probably in Salem. The Salem Town Hall walk-up testing facility has been very well run, and usually towards the end of the day, it's pretty easy for you to have a pretty short wait period and get tested. The other issue that we're running into is that we're running into the holidays. People want to travel a little bit more, so they're testing for travel. So people are testing for symptoms, contacts, and potentially travel.
Mm-hmm. Okay. Here's a good question. Who ensures that the vaccine is distributed equitably?
So the federal government tries to make sure, then obviously the state and local government tries to make sure that it's equitably. There is a vaccine commission in the state of Massachusetts that was formed to try to decide who's on the list and where. So when I look at the list, I have some issues with it. So public health is in phase 2. Now, I will have some people vaccinating, and my concern that as they should be in phase 1 if they're going to be a vaccinator. So we've essentially petitioned the state government to make some changes to say, hey, if you're a vaccinator, you need to be moved up to phase 1.
Okay, great, thank you. Do elders usually show symptoms? Or can people over 65 be silent carriers?
For the most part, anybody can be a silent carrier. Anybody can be asymptomatic. We tend to see our asymptomatic people in their younger generation, generally people, 0 to 19.
Okay.
But anybody can be asymptomatic.
Okay. Andrew, how can people who can't go out get vaccinated?
So obviously that's a concern, and that's why we do the drive-through clinics and look at that as a potential as the safest way to do it. We feel that if you're in your car, which is a pretty secure environment, you are staying isolated from people, you are staying away from people, you have your doors and windows up, and so it's a pretty safe environment, and we think that that's the best way to probably vaccinate people 65 and older.
Okay, thank you. That's the last of our written questions. And before we turn to raised hands, I have a question for you. Is there any question you would have liked us to ask you that so far we haven't asked you?
No, I think the hardest thing is that, one of the hardest things during this whole event is that we really need people to act not as an individual, but as a community. We have seen such detriment because people are just being so selfish rather than thinking about their neighbors, their other community members. And so we've been put in this really tough situation. And it could be better if you stop thinking about yourself. Social media to me has been the downfall of society. And one of the issues with that is that the shaming, so the shaming has been so bad that when we call and talk to contacts, they're unwilling to either answer the phone at times or give us any information. So if you're unwilling to give us information, that means that there are individuals out there that are also in potential danger or shedding the virus.
A follow-up question from our group: how should the public who abides by the rules interact with others who do not?
It's really best to take care of yourself, protect yourself. Yes, that can be very frustrating. I know when you're walking down the street and you see the person walking down the street with no mask on and you want to say, hey, what's wrong with you? We don't know everybody's story. We don't know if they have a medical condition. The best thing for you to do is to take care of yourself. Yes, stay greater than 6 feet away from each other. Have your mask on at all times, and remember to go home and wash your hands. I know it's frustrating. We are trying to work more on an educational piece than an enforcement piece. I don't want to have to be out there writing tickets. The police officers don't want to have to be out there writing tickets. It's kind of taking away from a lot of the other things that we're trying to get accomplished. Now, yes, there were a couple parties over the summer and we issued tickets for that based on reports that I get from the police station. But try to take care of yourself. If you feel like you're walking in areas that are highly populated and you're concerned that people are not wearing their masks, maybe it's time for you to either change the time of day that you're walking or walk in another area.
Okay. Here's a question I've often wondered about. Can you explain the different kinds of tests and different result times? Some seem to be rapid overnight tests. Some take a week to get results.
Yeah, so there are several different types of tests. And so we kind of break them down to an antigen test and a PCR test. And then there's the test that says if you've ever had it. So antigen tests tend to be a very rapid test, and you can get results in as soon as 15 minutes. And it could be as soon as 10 minutes, to tell you the truth. Now, the problem with that rapid antigen test is that it was 80% effective. So I had 20% either false positives or false negatives. So we had a huge concern with that. And depending on the data and stuff like that, it was actually worse at times. Now, the PCR test, so if you go and get tested and you use the antigen test, that's a probable confirmation. We need to confirm. So I push you back and say you have to get a PCR test. We require a PCR test for travel. So there's many times when we were in discussions with the state, we just said, why can't you get rid of the antigen test? Like, we're tired of this thing. You're generating work. I want to know what the truth is. Tell people the antigen test is no longer available and just get a PCR. Now, unfortunately, what was happening was that the testing facilities were making money on both and they were refusing to stop one or the other. And so it would just continue on. The PCR is, very accurate. And actually, there's a new Abbott PCR. Abbott Labs have come up with a test, and it's a pretty rapid PCR test that will start to come out. We will be using a rapid test in schools in the coming months. So if somebody comes in, they're showing symptoms, we can, as long as we have permission from their parents, we can administer a rapid test and do quick surveillance and say, all right, I got a positive. I need to test all the kids around them, or put those kids under quarantine because I know exactly who they are at this point. Or they were greater than 6 feet away for less than 15 minutes. They're no longer a contact and we can move on. The testing has been, a little bit trying at times. And one of the things that we should have done from the very beginning is China had a test that they were using. We wanted to be America. We wanted to be great and make our own test. We should have just been using theirs.
Thank you. Thank you so much, Andrew. I'm afraid our time is really up, and I said we would turn to hands raised, but we got more written questions, so I followed them. All right, we'll take Linda, and that'll be our last question, okay? But you're mute, Linda. Can you unmute? Can someone unmute Linda?
Yeah.
There we go.
I just want to ask, if you want to join the League of Voters, how do you go about doing it?
Okay, we'll come to that. Thank you. Wonderful question. Love it. We'll come to that in just a few minutes, okay?
So Kath, just to say one last thing, one of the things that we have just been notified of is that we want to make sure that everybody gets accurate and factual information. And you get accurate and factual information by going to government websites, mass.gov, the CDC, World Health Organization. The CDC could have been a little bit better during this pandemic, but we can deal with that later. But we want to make sure that everybody is getting the facts. We have recently been informed through federal government that Russia is trying to infiltrate us again through disinformation regarding the vaccine.
Thank you, Andrew. Thank you. And I just want to remind everybody that our League Observer Corps volunteer, Tom Kruger, attends and writes summary reports on Department of Public Health meetings, which are posted on our website and our Facebook page, and which are frequently published in the Marblehead Reporter. So Andrew those meetings provide a wealth of information. Tom tries to capture it accurately. And so you can keep up to date by reading those reports from Tom. And now, Andrew, I turn you back to Kathy, who's going to thank you properly for us.
Thank you so much, Andrew. We do want to thank you for sharing your time with us. I know you probably have a million things you could be doing instead of this, but we appreciate your efforts to keep us and our families safe and healthy, working with the school departments, businesses, and individuals, and of course, interfacing with the government. In honor of you and your department, we will be sending you a gift certificate for some goodies that we hope you can share with your hardworking folks of the health department, and that'll be a token of our appreciation.
Thank you.
So at the beginning of the program, I talk for about 5 minutes about the League of Women Voters, what we do in Marblehead and beyond, and how to become a member. So if attendees here want to stay on the Zoom to ask some other questions about League membership, please stay on. But if you have to get off, you can go to the website, lwvmarblehead.org, and there's information there about how to join. But if you have more questions, this is the end of the formal part of the program with Andrew here, although Andrew, you're certainly welcome to stay on too, but we'll be happy to answer any questions you have more about the League and some of our current programs. So we thank everybody. This has been a wonderful program. I really appreciate Andrew being here for us, and it's our pleasure really to learn more about what's going on in the town. So thank you, everybody. I'm going to give
Good going.
thanks. Did he just get off? I guess he did.
No.
Oh no, there he is.
Nope.
Thanks, Andrew. So we'll be sending something over. Really appreciate all your work. We can't, you never know what's going to come up during your lifetime, what you're going to have to address. I guess I think you better be saving your notes because you can write a book.
Never a dull moment.
Yeah.
Never a dull
right.
moment. And just please remember that I'm not going away. You can all email me. I will answer any other additional questions you have. I'm sure you have, concerns and thoughts, but please reach out to us. We would rather you get information directly from us than on social media pages.
Very
Here,
interesting.
here.
Thank
Here,
you.
here.
And you always do email us right back. So I appreciate it. You're always there. I don't want to say 24/7, but a lot of the time. Thanks, Andrew.
Yep. Thank you very much. Take care, everybody.
Yeah, you too.
Bye-bye.
Bye-bye.
Thank you. Thank you.
So we had somebody ask about membership, and Catherine is our membership chair. Do you want to go into it in any, well, first of all, I don't know if that person is still on here.
Yes, she is.
Oh, okay. Linda, let me unmute you here. Where'd she go? She
Right
just,
there.
oh, here we go. Oh, you're on,
I'm
you're,
on mute.
okay.
You're muted still.
Okay.
There you go.
Good.
So Catherine, do you want to talk to her a little bit more? It costs $60 for a year's membership. You get like 3 different newsletters. You get action alerts. I did at the initial part talk about, we have a book club. One of our big things we're working on right now is a racial justice committee that's sort of evolved over time. And of course, we do a usual voter service and voter registration, all kinds of things like that related to keeping our democracy healthy. But Linda, did you have some other questions?
How often do you meet? Like
Well,
this?
like this, I would, during the pandemic, I would say, well, let me put it this way. What we do is we have 2 meetings, we have a steering committee meeting every month that the members are welcome to come to. We have a current events group for all members. We have a book group, all members. What else? I'm sure I'm forgetting. Then we have sort of subgroups floating around, like our racial justice thing that we're going to record another program. Anybody can join any of these, but regular
And the Observer Corps.
Yeah, the Observer Corps. That's you kind of do that independently. Funnel that information to Bonnie. Is Bonnie still on here?
Yep.
Yeah, she is. And you can sign up to, monitor a meeting that's interesting to you, get a partner if you want to do that, so you can look at what each other are writing up.
And what books are you reading in your book group?
You know what we do? We do something unique. We each bring whatever books we're reading to discuss to the group and share with the group. So I'd be happy to send you, I don't know if I have your email, Linda. I'll send you our most recent book list. I think we have about 18 or so books that a month and a half ago we sit around discussing them. And they can be about league issues, but not necessarily. We do fiction, we do whatever people are interested in. So and then sometimes we put them in the reporter, and we just certainly distribute that list to our members as well. Anybody else that's on this? Tom, you
Yes.
can, or Catherine.
I want to just jump in
also-
about the book list for Linda. Linda, mostly we've been reading current issues like racial justice, on what's going on. So we've been educating ourselves because we realize that we're all very, 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 very white here. So we've been educating ourselves on the Black experience. So many books have been on that topic, and then we discuss them.
Linda, also, on our website, LWV Marblehead.org, there is a little section that has called the book group, and it has a list of books that we've read at various times. So you can just go through that. Kathy Leonardson does a beautiful job of writing up small summaries of what we talked about. So it's a really wonderful
Oh, great. Okay.
resource. Yes.
Tom, do you want to address the membership portal on the website?
Yeah, okay, yeah.
for Kathy?
It's actually fairly simple. So via LWV Marblehead.org, when you sign on, in the top right-hand corner, there's a button that says join, and you just enter information in there. And at this point, we don't have a way of paying electronically. So we have you then send a check to our post office box, and it's all listed there. I think when we mentioned $60, I think it's important for everyone to know we don't keep much of that. We keep only $5 of it. We paid dues to the state and the national League of Women Voters, as so that's what it's pretty much for. So just think that's important to know.
Thank you. Thanks.
So Linda, if you put your email in the,
That's what I'm doing.
oh, I was gonna say in the chat, then we can send you some more information.
Who had
So
their hand up just then? Kathy?
Kathy Hempel.
Muted.
Yeah, I guess I wasn't aware of the racial justice group, and maybe I should have been, but can you speak to more about that? Because I think I have some folks that might like to join and participate in that? So
Where's Kathy Marie? Kathy Marie, why don't you talk about that?
Kathy Hempel, we just started this. It actually came out of the time when we were talking about doing the recording that you participated in on women of color, our program on that. It really, we realized what an important issue this is, and we want to be part of it. And the town is setting up, they're using about the Marblehead Racial Justice Team, the Marblehead Selectmen's Task Force on Racial Justice, and Team Harmony at the high school are beginning to form a racial justice team. And so we've just asked to be included on that so we can be in the ground roots of that, because we've already been discovering that Black people do not feel comfortable in this town. And now that's something I want to work on,
yeah.
How we can change that.
So what would I say to people that I think might be interested in joining the league versus one of the other groups you mentioned?
Well, we do.
Yeah, go ahead, Kathy.
We do a lot more. That's not our main focus. It's one of our focuses. Okay. And we have many different focuses, like Kathy said, a gun study group, current events group, different focuses, whereas the other groups are just focused on that.
Well, the other part, Kathy Hempel, is that we do a lot of advocacy, and we have a huge racial justice group at the state level that are advocating really hard for that police reform bill. Some of the people on this call are involved in that, but you get action alerts asking you to, for example, this past week, contact the governor, and there are going to be some more coming out. And, it's one thing, that's why we're multi-branched. If you think about it, we're working at the local level through our own specific legislators, but then we also have this state level, really powerful advocacy that we do. And, I'm on that group, so I could tell you what we've done in the last 6 weeks. And believe me, it's really impressive, but it allows you to have input at a level that can make a difference for everybody in the state and change things like, things that have to do with structural racism, things that are already built into institutions. You never know how to get like this. And, it's a broader view than just thinking about how can we make Marblehead more welcoming to people of color and diverse origins. So it's multi-levels. And they also do it on the national level. We've had some action there too.
Yeah, and I think that's a big difference between us and the other groups. I don't know that the other groups have a legislative branch where they're reaching out to enact change in the legislature, to lobby for change in the legislature.
Maybe I should put out some information on that specific topic and all the different things at different levels. And Kathy, of course, you're welcome. And, you always would be welcome to invite your people that might be interested to come to one of our racial justice, whatever, little subgroups meetings we have, and we'd be happy to include them. We can liaison with them, whatever, so they can find out firsthand.
If you wanted a guest speaker, Reverend Andre from Lynn is absolutely fantastic. He spoke at the big meeting that we had at St.
Andrews.
Clifton Church.
Yeah.
Yeah. We have
Right.
Black members in our Unitarian church, and our group there founded the group that meets at the library, the social justice. It's really beautiful to see so many groups beginning to look at this.
I think the next step is probably to get all the groups to periodically communicate with each other, because there's so many of them. We're just at the point of trying to liaison with all of them, say, what are you doing? What are you doing? And how can we, amplify the power we have here in town by joining forces?
Mary Gardner, who lives on Washington Street, is the main contact for that.
Okay.
The one that meets at the library. I'm sure that they'd like to, be in communication.
Oh, thank you.
And Mary was at our meeting for,
Yeah, I did. Yeah.
for most of it, yeah.
Kathy Marie, did you know Mary Gardner? I'm thinking, because you went to a couple of those meetings at the library. I did too, but I don't remember the
Yeah, I
names.
also went to the last call that was on Zoom, their first Zoom call. You're talking about the Marblehead Racial Justice team, right, Linda?
Yeah.
With I thought it was Cheryl Boots and Jim Bixby who were the co-chairs. I missed Mary's name.
Yeah, I don't know. It may have gone into its second election, you know, she wasn't.
Yeah, oh, that must be it. Okay. Okay. I will reach out to Mary.
Yeah, that's what our little jobs are now for our racial justice group. We each have a list of people we're contacting, like I'm, around town to try to see, what are you doing? This is our interest. How can we work together? We're just all, that's our little job
know,
right this minute.
Kathy, what do you think about turning the recording off now?
Okay.
Oh, good point.